Good afternoon, dear Chairman, dear audience. In the next few minutes, I would like to present my PhD thesis entitled Investigation of the Effects of Biological Therapies on Cardiovascular Risk. I am Noémi Galajda, first-year PhD student at the Department of Dermatology, Venerology, and Dermatooncology of Semmelweis University. My supervisors are Ágnes and Péter Holló. My vision is to reduce the burden and mortality caused by comorbidities in immune-mediated inflammatory diseases. And to achieve that, I would like to optimize the therapeutic sequence, taking into account their effects on comorbidities. Here are my specific goals with the two ongoing projects. While in the first one, we would like to investigate the effect of TNF-inhibitors on the risk of cardiovascular events in all immune-mediated diseases. In the second project, we aim to focus on the most common immune-mediated disease, psoriasis. So the title of my first project is Investigating the Effect of Tumor Necrosis Factor Inhibitors on the Risk of Cardiovascular Events in Immune-Mediated Inflammatory Diseases. Cardiovascular diseases are among the leading causes of morbidity and mortality worldwide. The main pathogenetical cause is the atherosclerosis, in which a key inflammatory player is the tumor necrosis factor. In immune-mediated diseases like psoriasis, rheumatoid arthritis, or inflammatory bowel diseases, there is an increased risk of developing cardiovascular diseases through the chronic systemic inflammation. The tumor necrosis factor inhibitors are widely used biological treatments in this population, and through the inhibition of TNF-mediated pathways, they may have a beneficial effect on cardiovascular comorbidities. Unfortunately, they have a high cost, and this can be one of the major causes that they are generally not among the first-line therapies. In contrast, the conventional immunosuppressants like methotrexate, they are much more affordable, but they do not act directly on TNF-mediated pathways. So based on this background, we would like to investigate the effect of TNF inhibitors on the risk of cardiovascular events in all immune-mediated inflammatory diseases. So our clinical question is that do TNF inhibitors have an effect on the incidence of CV events? Patients with immune-mediated inflammatory diseases will be enrolled, and we would like to compare the TNF inhibitors with non-biological therapies, and the measured outcome will be the incidence of cardiovascular events. We hypothesize that TNF inhibitor treatments can decrease the risk of cardiovascular events in this cohort. Our clinical implication is that if the hypothesis were true, TNF inhibitors could be used sooner as a first-line agent to reduce CV burden. The systematic search was conducted in the middle of November using 3 different databases. Here's the flow chart of the selection. After the systematic search, we had more than 8,000 hits. And performing the duplicate removal and the title and abstract selection, we got more than 100 articles. And at the end of the full text selection, we expect around 40 eligible articles. While in the second project, we investigate the effect of TNF inhibitors in all immune-mediated diseases. In the second project, we would like to compare the different biological therapies in a specific IMID group in psoriasis. Psoriasis affects more than 100 million people in the world. The symptoms involve mostly the skin and joints, but it is widely accepted now that the psoriasis is a systemic inflammatory disease, and through that there is an increased risk and prevalence of cardiovascular diseases. The tumor necrosis factor is one of the most important inflammatory cytokine in the pathomechanism of psoriasis, but the major pathway is the interleukin-23 Th17 axis. Both the TNF-mediated and the axis-mediated pathway share common immunological pathways with atherosclerosis, thus cardiovascular diseases. In psoriasis, there is an evidence from 2015 that TNF inhibitors can decrease the risk of cardiovascular events, while regarding the interleukin-23 Th-axis inhibitors, there is a lack of evidence whether they have an effect on the occurrence of cardiovascular events. So therefore, we would like to compare the effects of different biological therapies on the risk of cardiovascular events in psoriasis. The clinical question is that what is the best biological treatment to decrease the risk of CV events in patients with psoriasis? Patients with psoriasis and/or psoriatic arthritis will be enrolled, and we would like to compare the different biological therapies in the second project. The outcome would be the same, incidence of different cardiovascular events. So we hypothesize that the novel interleukin-23 Th17 axis inhibitors are superior to the TNF inhibitors. And our clinical implication during this second project is to choose the best biological treatment to reduce the CV risk in patients with psoriasis and/or psoriatic arthritis. So as a summary, I can tell that while in the first project, we would like to investigate the TNF inhibitors in all immune-mediated inflammatory diseases, in the second project, we compare the biological therapies in the most common immune-mediated inflammatory disease in psoriasis. So thank you for your kind attention, and I would like to share a quote from Ágnes. If you are curious, you will find the puzzles around you. If you are determined, you will solve them. Thank you.
Thank you for your presentation. I was wondering, in your second project, you were listing the interventions, and why is it not a network meta-analysis? Why a meta-analysis?
Thank you for your question. It is because most of the articles and the studies are not randomized control trials and cohort studies and case control studies. So this is why we are considering to make a meta-analysis, not a network analysis.
Thank you.
Jakub Ferica, Gastro Group. I would like to ask about your second topic. In IBD, the anti-TNF usually fail after some time. Are you interested in IBD? If you have a treatment with anti-TNF, there is usually non-risk. It will fail after the time. Are you interested only in the decreased risk during the medication, during the time of administration of the medication, or only with anamnesis of administration of anti-TNF, or what will be the observation for the effect from the administration of anti-TNF? Thank you.
Okay, thank you for your question. If I understood well, basically we would like to investigate their effects during the use of these drugs. So during the follow-up period when these products are used.
May I have a question? You mentioned in your first project that in the population you would investigate immune-mediated disease patients. Are you planning to compare the two therapies pooled, or are you planning to do a subgroup analysis based on the diseases?
Yes, thank you for your question. Yes, it is planned to make subgroups not only based on the type of immune-mediated diseases, but also based on different kind of comparators and follow-up periods, and even based on the different kind of definitions of cardiovascular events. So it is planned to make more subgroups analysis.
Maybe, if you don't mind me asking, in psoriasis, you mentioned there's an increased risk for cardiovascular disease.
Yes.
Do you know what sort of potential additional variables may affect that when it comes to patients, like obesity or other risks in the background that may also increase that risk, that just confound potentially the results?
Yes, you mentioned obesity. This is one of those risk factors, but also smoking and hypertension, for example. But severe psoriasis is also a risk factor after adjustments for developing cardiovascular diseases. So.
And also, are you planning to do any sort of subgroup analysis, or can you adjust for this somehow, like look into patients with that are smoking, for example, or not?
Yes, it is planned to make subgroups based on the population's characteristics.